Hi, I'm Dr. Hisham, and I want to ask you a question. Do you seriously consider or think about or read the labels of what's in your toothpaste and other oral care products? Just as much as more and more people today are reading what's in their food, what's in their skincare. So many more women, especially, but of course, men included here as well, care about exactly what's in their skincare and the organic ingredients and even what's called natural. They question that and they check it and they have so much options out there. Yet, so many people, if not most people, including professionals and dentists like me, never question or read or consider what's in their toothpaste. So this is what I want to show you today. One specific incident that brought this to mind and made me really want to do this video and say, hey, somebody's got to speak up about this, not just I know it, so what? Because I haven't used toothpaste for any kind of toothpaste, any brand of any kind of toothpaste for the last 16 years, neither did my family. So it's not just about what I know, it's about asking people, do you know? And if you don't, why don't you find out before you put things inside your mouth? So the story goes, about a couple of months ago, a guest of ours, a regular guest of ours, who's been coming for many years and always healthy, actually has been using my products for a long time, everything fantastic. She calls in for an emergency that her gums are bleeding. Well, that's not normal for her. So please come in as soon as possible. We saw her within a couple of days. She comes in and says, suddenly in the last few weeks, my gums have started to bleed gently when I'm brushing my teeth, but also I have these purplish discolorations on my gum. I'm like, well, before I looked inside her mouth, I said, well, if your gums are inflamed, usually they will bleed, and when they're inflamed, they look reddish purplish. So the look matches the symptoms, but let's see why that's happened. Did you change your brushing habits? Did you change your eating habits? Because you've always been healthy. No, nothing that I can think of. Anyway, so I look inside her mouth, under the microscope, as I always do, and very clean mouth, as always. But yes, I can see that purplish stain, little halos of purple around her gum lines, and when I touch them, they start to bleed. I'm like, that's strange for her. So I look closer, increase the magnification, and I look closer, and I pick out these little blue dots, which had this red halo of obviously reaction inflammation around it. I'm like, well, that looks like little seeds, but they're too small to be seeds. I'm asking her, so what is this? Do you know? She says, I don't know. I've never seen these things because she hasn't looked up that close. They look like seeds, but they're too small to be seeds. Could they be blueberries, whatever, something stuck in your gums? She's like, no, I can't think of anything. I'm like, well, anyway, long story short, we went through all the questions, and at the end I asked her, okay, well, what are you using to clean your mouth? Are you still using the serum that we've given you over the years? She said, oh, no, actually I ran out, I was overseas. So when I came back, I just bought a professional grade toothpaste from the supermarket, and I started using that. I'm like, well, okay, first of all, there's no professional toothpaste in the supermarket. No matter how the packaging looks like, they're just, soaps and detergents in tubes. Anyway, that wasn't the point. I said, well, what is it? What color is it? What did I say? Oh, it's like a gel, but it's got a bit of grit on it. Actually, it is a bit blue. I'm like, really? So, do you remember the name? She said yes. I looked it up, and of course, online, I could see exactly what's happening, and I was like, I think it's that toothpaste. Here's some more serum. Start using that. We polished all the little bad stuff that's stuck in her gums. Gave her the serum. She went away. Everything was fine. Of course, what did I do? I went to the supermarket and bought that toothpaste. And this is what I'm here today to show you, not just to talk. Talk is cheap. When you see it and you ask questions and you think and you decide for yourself, then you're more empowered. So this toothpaste, and I've covered the brand because I'm not talking about the brand here, it's just a type of toothpaste. Comes in a box like this that says Pro Health Advanced, Deep Clean, anti-cavity, all these very professional looking things in there. And it says, with dissolving microparticles, the paste provides you a deep clean that fights plaque even in hard to reach areas. So, and of course on here, like all toothpaste, it says apply onto soft bristle, brush thoroughly twice a day, do not swallow, not to be used by children under 12. In case of intake of fluoride from other sources, consult a dentist or a doctor. I don't know what that means because fluoride is in everything. It's in the water, it's in the food, it's everywhere. So anyway, regardless of all this, it's this dissolving particles. And then when I opened it up, I noticed these, I don't know if you can see it better in the sunshine maybe, very bright and very gritty particles. very bright blue, super gritty particles. Now, the grit itself is one of the reasons why we don't use toothpaste, even natural ones, because they all have grit in them, calcium carbonate or silica, and that's a bad thing, and that's a whole different discussion. So the concern here is those blue particles, and I'm like, what the heck is that blue stuff? So I went to back to the ingredients, and in the ingredients, other than the usual soaps and detergents and everything else, oh, by the way, it says it dissolving particles. Well, I put it in water and then soaked up the soap scum and all the other abrasives that are here just with a tissue, and you can see clearly, I don't know if the camera is zooming in properly on there, they don't dissolve in water. Mind you, it's bad if they don't dissolve, and it's much worse if they did dissolve. It's bad that they don't dissolve because this means it gets stuck inside your body, inside your mouth, inside your gums and all these things, and of course we let it out into the environment, these plastic microbeads. And if they did dissolve, that's even worse, because if you read the ingredients and you know what they are, you'll find out how horrible it is if they did dissolve. So ingredients: glycerin, silica, the abrasive, propylene glycol from propylene gas, petrochemical, sodium lauryl sulfate, soap, and so on and so forth. Anyway, saccharin, fluoride, and all these things. Okay, I'm not going to discuss all these details. Nothing about, you know, the blue stuff. At the end it says CI 74160. CI 74160. Code. I don't know what that means, and of course most people don't know, and that's what they rely on. Look it up, and it is copper phthalocyanide. It's an acrylic paint. It's a bright blue acrylic and plastic paint. It's got nothing to do with food. It's never been approved for any food ingredients. It's approved for plastic colorings. Probably it is in the packaging here and in this packaging here to make it bright blue, and that's okay. I don't have a problem with that at all. Painters use it for paint, as an acrylic paint, and it's in plastics. I'm like, what has that got to do in the human mouth? Why is that there? Phthalocyanide, copper phthalocyanide, to use every day, ingest into your body and let it out. I looked it up more and more, and I found out that this has been banned in the United States, I think 2 years ago, or a year ago. They've been banned over there, and they brought it to Australia and New Zealand. Very interesting and very challenging, really, when I consider what's going on in this world today, because what we put in our bodies is what we become, and the mouth is absolutely the most important. It is the portal to your whole body, to your guts, to your health, to what comes out of, what goes on inside and what goes through inside it, through your mouth, is all going to determine your health. Plus what we let out in the environment. Why is this stuff put in our toothpastes and given to us and to our children and everybody else to be consumed every day? Big questions to ask. But instead of challenging them, we as dentists tend to accept all these freebies. We, by the way, decline toothpaste samples in our practice. For many years, that's how I didn't know about this. But when I spoke to colleagues over the last few months since I realized this, during my courses, they go, oh yeah, we got that toothpaste as samples. We started giving it away, but then we realized how gritty it is. And we noticed these blue things on the gums as well, so we stopped. I'm like, well, did anyone speak publicly about this rather than just in my practice? And it's good that we're realizing these things and stopping them in our practices. Did we speak out and tell more people about this, or we're just going to be quiet? So I decided, well, what have I got to lose? You know, just tell everyone about it. You do what you want to do. You think, please, for yourself and for your family, for your best health. Think, read, analyze. If something is gritty and you put it on your teeth and it starts to grit, like all natural toothpaste and conventional toothpaste do, that's not a good thing, the grit itself. Then the ingredients. Are they natural? What the source is? But most important is, are they natural in effect, not just the source? Because that same company, for example, same corporate, owns multiple brands. One of them is and again I'm covering the brand here because I'm not going to mention the brand itself, but you'll know what I'm talking about. They sell $1 billion a year lolly in supermarkets, of course, in the health section, not in the lolly section, and pharmacies, and people think it's sold as a health supplement. So when you have a sore throat, and it's called, for example, one of their brands is called Vapo Natural. It's got nothing to do with Vapo Natural. Nothing to do with natural, it's just a word that's there. Regardless of the source, the nature, there's no natural effect at all. Because these things that say coats dry and itchy throats with honey, when you read the ingredients, it clearly says so. And thankfully they can't lie about the ingredients, but people don't read that. They just look at this, they trust the brand, and they pay the money, and then they get sicker. So this is what you're supposed to have when you have a sore throat or infections or disease. First ingredient is sugar, sucrose. That's glucose and fructose together. Second ingredient is glucose syrup, more glucose. Third one is honey, more fructose. And then natural flavor. That's it. It's a hyper sugar bomb that no doctor, no dentist, no voice coach, even a voice coach would tell you, do not eat sugar or consume sugar regularly, let alone on the day of your performance, because it dries up your throat, it's bad for your teeth, it's bad for your gums, bad for your guts, it spikes you up. Everything's wrong with it. And this is sold in the health section of the supermarket and in pharmacies. And people, including doctors and dentists and everybody else that I know of, many people just use it all the time. That is horrible. That is horrible. I don't mind anything being made out there as long as people know what it is. And if you know that it's not good for you but you choose to use it, that's called freedom of choice. But if it is sold to you as good for you or healthy for you, but it's not, that's not right. So if I say my products are natural, and I do say that, creation of natural oral care products, I'm not talking about the source of the ingredients only. I'm mainly, actually primarily talking about natural in effect to the human body, to the environment inside our mouths, and to the environment outside of us. That's what matters, because in reality, everything is natural. Lead is a natural substance, mercury is a natural substance, and cyanide is a natural substance. There's no argument about that. They're just not natural for the human body. So leave them where they are in nature, or use them for industry or whatever, but don't use them inside the human body. So be careful, watch out for the word natural. What does it mean? Read the ingredients, think, try, test, and find better options for you and for your family so that you can always look better, feel better, and be better. Thank you.